If you've never done a stool test before, it's an obvious choice, in my opinion. It's a place where a lot of practitioners start. Like I said, I mean, it is a first line test for a lot of functional practitioners out there.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, what's on the menu? Is it functional testing today?
I believe so. I mean, you know my favorite topic ever is food. But once it goes down the hatchet, I'm not sure what's happening with it. And we don't usually touch it, that kind of topic. And I was thinking it would be interesting to learn more about, believe it or not, stool testing. It's a whole field that is exploding, touches a little bit about functional medicine and other topics. And we have a guest today who can maybe help us understand, what is it? Why do we even need this? Can you introduce our mystery guest?
Absolutely. We have Cat Simmons, who is a registered dietitian nutritionist, and she's spent a lot of her career in the functional laboratory diagnostic space. She runs a lot of educational activities, helps with consults when people have questions, especially since she's a member of the educational team, of the medical education team at Diagnostic Solutions Laboratories. And Kat, welcome to the podcast. We are ready to pick your brain and pick your gut.
Awesome. Well, thank you for having me. Hope I can pique some interest here.
Excellent. All right. You're now part of the family. All right. So it only takes one pun. That's it. You're in. So, Kat, I think maybe we should start shockingly in the beginning. Tell us, to those of us who are listening and are not familiar with stool gut testing, what is the lab that you working in are doing, and what is your specific role there as a dietitian nutritionist?
Yeah. So, being a laboratory dietitian, which is I kind of fell into that early in my career. I predominantly do education. So interpreting labs, helping practitioners understand what's coming out on that piece of paper. I'm certainly not in the lab processing samples. And when it comes to stool, it's kind of, a topic that most people cringe about, don't really want to think about. But at the end of the day, looking at stool and assessing what is there, you're getting a snapshot of the endpoint of your digestion, everywhere from the microbiology, kind of microbiome analysis, but also functional chemistries. So looking at digestive markers, inflammatory markers, anything that, can indicate immune system, kind of an upregulation in immune system. Is your immune system flaring, your mucosal immune system, that is the immune system in the gut. So I predominantly focus on practitioner education. I've done a lot of direct to patient counseling in my time, and I certainly do play that role. But right now I'm predominantly doing, lab education to our providers, because there's a huge learning curve. This isn't something that most practitioners are taught in school these days or ever. And so a lot of practitioners are relying on functional labs to educate them and get them up to speed on this advancing field. And so we take that very seriously. That's a huge honor and a privilege. And so we want to just make sure we're educating factually and the right way. And the lab I'm with currently, we run the GI map stool test, which is an industry leader for a reason. It's a great test, and, it gets the job done, honestly, more concisely than other tests on the market, just because really you kind of walk away with some actionable results. Sometimes with functional testing, you get lots of pages, it's confusing, you don't know where to start, you don't know what's meaningful, what isn't. So that's our job, to kind of help practitioners figure it out, work through the weeds, take out the relevant information, and help put a plan together.
Thanks for giving us a quick overview, little background on things. Now, I do have a question just to take a step back, because I think gut testing has so many questions about how can
Yeah.
we use this? What are the options that we can look into? Can you give us an overview on what are the approaches that are there when looking at gut testing in terms of what are the things that you can measure? What are the ways that we can look at leaky gut also as well? Because there's bacteria, there's fungi, there's functional testing, and then there's also like how do you measure leaky gut? Can you give us an overview, not specifically to any one test, but just an
Yeah.
overview, and then we can dive into specific tests after that?
Yeah, well, there's certainly a few different ways to go about it in terms of leaky gut specifically. So, I guess, a question to ask yourself is what is leaky gut? And leaky gut is essentially intestinal barrier hyperpermeability, where, in most simple terms, the way I explain it a lot is kind of like a brick wall. If your intestinal cells are bricks and there's this entire protein complex that kind of is analogous to the mortar, how good is a brick wall if all the mortar is disintegrated? You just got a pile of bricks. And when you think of your intestinal cell wall as the barrier between your external and internal environment, and that breaks down, having leaky gut sets your systemic circulation up for foreign invaders, and having foreign particulate that shouldn't be there, and that can overactivate your immune system and lead to a whole variety of systemic symptoms. And that's overly simplistic, the brick wall analogy. I've been using that for probably a decade, and it made sense in the beginning, and it still makes sense now, which is why I like to bring it back. But it's a lot more complex than that, of course, when we're talking about kind of the interplay of the cell wall, the microbiota, the immune system. There's lots of layers there. But in terms of how to assess for it, I mean, I guess that sort of sets the stage for looking at these layers. We have the cell wall itself, and there's, kind of this hallmark protein called zonulin that Dr. Fasano, discovered back in the early 2000s. And so that is a protein. That's a protein that regulates kind of the permeability in the tight junctions between the intestinal cells. So that can be measured. That zonulin protein can be measured in stool. It can also be measured in blood, and there are labs that do that. You can also look at the zonulin protein itself. You can look at antibodies to the zonulin protein itself. So either blood or stool would be the best way to assess zonulin specifically. But there's more to it. There's way more to it than just zonulin. And I think a lot of practitioners hone in on zonulin because it is very important, but it's naive to think that it kind of ends there. So using a stool test where you're looking at kind of more of a microbiome analysis can get at dysbiosis patterns that regulate that permeability and even regulate zonulin flux. And so and this takes time to learn, and it takes experience in looking at tests and determining patterns. But you may have an overgrowth of inflammatory bacteria that sort of lead to LPS mediated inflammation. You may have a lack of the good guys, the commensal microbiota that produce things like short chain fatty acids that help to fortify that gut barrier. So that's really where stool testing comes into play. You mentioned things like fungi in the gut certainly can drive permeability, and you can test for those. You can test for the microorganisms themselves in stool. You can also look at blood tests for fungal antibodies. And there's also things like breath testing for SIBO. SIBO is a big topic that I don't really want to focus on here today, but SIBO is a condition that's well recognized that can drive permeability. So there are breath testing to look at, they're looking at gases given off by intestinal microbiota, and they can be confounded, by like your microbiome in your mouth and things like that. So they're not always as sensitive as looking at something like a stool test to infer those patterns. So that was kind of a long-winded answer, but hopefully that, I don't know, gave you some some direction to that question.
No, that was great. And actually, as a follow up to that, when it comes to leaky gut, I know you talked about zonulin or antibodies. A lot of people look at the lactulose mannitol ratio. What do you think is the advantages of doing a blood test like zonulin, or do you think the accuracy is similar? What's your opinion on that one?
Yeah, well, like I said, breath testing has been around a very long time. I think it's a little bit antiquated when there's superior technologies available today. Breath testing, like I mentioned, can be confounded by if there's dysbiosis in the mouth and methane, for example. There could be a lot of methane given off just by the oral microbiome. The other thing about the breath testing is that it usually involves prep on the patient's behalf. There's usually like a prep diet that needs to be followed. So that can be challenging, and, there can be compliance issues. So there's just, stool testing has evolved quite a bit over the past couple decades. And, we're way beyond just a lab tech, looking at a sample through a microscope, with genomic testing, genetic testing. There's 16S PCR, there's quantitative PCR, there's shotgun metagenomic sequencing. So this day and age, there's just a high degree of sensitivity that comes from stool tests. And when you're looking to analyze kind of the endpoint of digestion, it's really the only way to go, as much as it may be a little bit cringeworthy to think about.
No, I appreciate that. Now, what about the lactulose mannitol, the one that, they take it orally ingested? It's a urine test to look at those ratios. I know you touched on the breath testing for SIBO, which is awesome. I'm curious what you think about that versus, zonulin antibodies.
Yeah, this is something that's been around a long time. Most functional testing has moved away from this. I think the sensitivity is just not there. Again, it's indirect. You're relying on kind of a metabolism of sugars, which, if you have certain dysbiosis patterns, that can be metabolized different ways. Urinary testing can give a lot. Urinary testing in general, I don't know, it's a very broad stroke. You can get little bits of information about a lot of things. So it kind of casts a wide net in that regard, but it's a little bit indirect because it's dealing with urine as a specimen. There's a lot that goes on before we produce urine, I guess, is the best way to answer that. So it's honestly not something that I've worked with a whole lot. It just hasn't been a predominant testing in the space I've been in for as long as I've been doing this.
So, Kat, I liked your initial idea of kind of looking through the waste process. Almost remind me of like a good FBI film where they go to the garbage bin, kind of look, and from that deduce kind of what happened in the house, and your kind of role as a consultant and available through the lab. It's kind of a cool service to have when you have a question about a report that you can call. I think a lot of dermatologists can relate to that in their relationship with a dermatopathologist, for example, where when we look at the report that doesn't make sense to us, we can just give them a call. So I think one of the questions that I had is, what are some of the tests that really function well, in your opinion, when it comes to that process that goes from the moment, basically let me rephrase this. What you're looking at is processed end result of some process that happened way up in the gut, right? Potentially what you're looking at also is not necessarily related to the process that actually is going on in the gut lining. How do we know that it's really what we're looking at is the disease process as opposed to just extra stuff that went through the gut? And then we can kind of think backwards on how it relates to disease. But I guess why should we look at in the stool and not necessarily take maybe direct samples from the gut and the gut lining?
I mean, it's an easier process than going through a procedure. I
Yeah,
don't
no
know.
kidding, right? I mean,
Yeah, I mean, just the usability of it for the patient. I mean, even doing something, you can kind of compare the analogy to something like a blood test for celiac antibodies versus getting a small bowel biopsy. I mean, the sensitivity and specificity of antibody testing for celiac is much higher today, so that a lot of practitioners are relying on that solely for the diagnosis of that disease. So that doesn't address the stool test question, I get that, but it's a little bit of analogous to it. So we're not doing that. I mean, the practitioners are not going out and getting scopes and biopsies just as part of a wellness panel. That's kind of a GI specialty. So these are tests that any practitioner can run, and a lot of our practitioners we work with really do run them first line. I mean, we have multiple practitioners that are like, this is the first test I run. I insist on this for most of my patients, just because it does give us a ton of insight, both to GI specific, but also, to systemic ailments as well, like the skin. And we see those connections all the time. It's easier than a blood test too, half the time. I mean,
Yeah,
unless you're doing something like a finger prick, a lot of antibody testing now are available through finger prick, which is easy, but it's a lot easier than going and getting phlebotomy, especially, coming out of the pandemic and COVID times when, no one wanted to leave their house. So
absolutely.
yeah.
And is there a difference when you test for certain tests if it comes from different parts of the gut as it kind of the stool kind of gets formed through the gut process? Is there a difference in the test as you go through them, and does that affect their specificity and sensitivity?
Yeah, that's a really good question. That does certainly complicate things. I mean, the answer to your question is yes. I mean, if you think of stool, it has traveled through the entire intestinal tract. So, this kind of gets into the nuances, but most of the time with collection instructions, they are encouraging you to take from multiple sites in a stool sample. In literature, I mean, in research rather, the most appropriate way to do microbiome analysis is to do hemolysis and take the entire sample and, kind of blend it up. We're not asking people to do that in their homes. That would be a little bit, the user the user experience would be pretty poor on that. But yeah, you usually do take from multiple sites, and it can influence it because microbes colonize different areas of the intestine.
Got it. And I think a lot of patients are now taking probiotics. And does that affect the result of a test when you look at it? If a patient, for example, took for weeks or months is on a certain probiotic?
Yes and no. I think that is good information to share with your practitioner. When I do interpretations, I do often, it's a good question to ask your patient, were you on probiotics at the time of this test? If so, which ones? We don't, I mean, most labs aren't requiring that patients come off of probiotics prior to testing. I mean, probiotics are by definition somewhat transient in the gut. So if you were on probiotics for last month, it really probably shouldn't have an effect on today's stool sample. But it's good information to have, especially if you see, well, in both case scenarios. I mean, sometimes you see overgrowth patterns, and, that could potentially be related to high dose probiotics you may be taking. And then it's also good to know that if there's, insufficiency dysbiosis, a lot of times the gut reaction there, pun intended, is to recommend a probiotic. But a lot of times we get into this scenario where it's like, well, I'm already doing that. So now what? And that can give us insight into colonization resistance and potentially malabsorption. I had that happen earlier today as well, where, patients are doing kind of the right thing, taking good quality products, and, their gut is still completely depleted. And so we got to look to other angles. And in that case, we actually looked at digestive markers. Their elastase level was extremely low, and I think there was some fat in the stool. So we were just kind of talking about the potential for malabsorption. So I think, regardless, with any lab, it's important to ask the right questions.
Right.
What we're doing with functional lab testing is we're trying to practice precision medicine, right? And so the only way to do that is to make sure you're asking the right questions of the patient. And I mean, a lot of what I do in my consulting with practitioners is asking them, the right questions so that, they can think about that and take it back to their patients.
So I asked about probiotics, but maybe the more obvious question in our culture is antibiotics. How do antimicrobials in general, antifungals, antibiotics, how do they affect the test results?
Oh yeah, they absolutely do. I mean, and not only just transiently, but lifelong history of using antibiotics. So that's always good information to have, just I mean, I don't think there's a single person out there that's never used a probiotic in their life. Well, maybe, young children or something that haven't gotten there yet, but they are widely used. And I'm not here to say that they're bad things.
Did you mean that antibiotics are widely
Oh,
used
did I say probiotic?
Yeah, but I
Yeah,
just
I
wanted
meant
to clarify.
antibiotic. Yes, sorry. Thanks for
Because
that.
maybe everybody's using probiotics too, which would be pretty awesome.
I mean,
Yeah.
yeah. I mean, at this point, probiotics are basically on everybody's radar. They should be. But yeah,
Yeah,
I'm sorry, I
exactly.
misspoke there. So antibiotic use. Yeah, so antibiotic use can have a huge effect, both, lifelong use of antibiotics, but also transient use. Typically with stool testing, and this comes up with repeat testing, if you're going to do a follow-up test, if there's going to be any sort of protocol used, antimicrobial protocol, we typically recommend waiting about 4 to 6 weeks after finishing that protocol before testing, because you want to give the microbiome a chance to sort of stabilize. If there's an organism that you are trying to get rid of, something like, H. pylori, for example, you want to make sure that, your protocol, like, okay, maybe it got rid of it, but we want to give ample time to make sure it doesn't grow back up. So that 4 to 6 week mark is a good benchmark if you're using, antibiotics. And that's a question I always ask too. If we do get a test that's very wiped out, very depleted, sometimes I will ask the provider.
Can you tell if somebody's on antibiotics right now and you get a stool sample, like, oh, this person's on antibiotics. This is kind of a useless test or something. You can tell immediately.
It's but then sometimes you're surprised. I mean, yeah, you can get a report that looks completely depleted, and you might think, oh gosh, I wonder if there was any recent antimicrobial use. And, that's a question I always ask. But I'd say half the time I'm surprised and they haven't been. And the gut is really just that depleted. And maybe there was long term use, maybe there was poor diet. And also think about it, right? Like in our society, unfortunately, if people are eating a lot of conventional meats, conventional dairy, we're getting hit with low grade antibiotics all the time. And
Right.
so, we've got to take that into consideration to, same thing with the pesticide load that we ingest, even from, you don't have to tell me, I'm a dietitian. The amount of times you're encouraging people to eat more fruits and vegetables, but strawberries are number one on that dirty dozen list. And I'd almost be apt to argue that eating a conventional strawberry that's, basically saturated with pesticides may be doing more harm than good to your gut. And that's a completely different topic for another day, but it does relate to our conversation.
Yes, this is fascinating to me because we can talk about stool forever. Maybe it's a good time now that we got some good understanding as to what's going on any kind of day to day to give us an example of a typical case that may come across your desk as you go through these tests.
A lot of people that are willing to, or seeking out, I should say, stool testing, usually, it's intuitive, right? You think, okay, I have digestive symptoms, let me do a stool test. So we do certainly get a lot of cases of gas and bloating, for example, abdominal pain, intermittent constipation, diarrhea. Those are very, very, very typical symptoms. But, we also get cases where people are just looking to optimize their health. So they're, running this as a wellness tool. We also get, cases of extra intestinal symptoms, skin being a huge area of interest, but also, chronic migraines and allergies. And, the allergy world and the skin world, there's tons of overlap there, of course. And that's a huge area of interest from mine. And we do see really, really, really strong patterns. And it's kind of interesting too, if you look at a stool test next to something like an IgE allergy profile, or even an IgG food sensitivity profile, you can connect a lot of dots that way.
Well, Kat, I have to say, this was a really good summary. I guess to kind of take a clinician's standpoint on this, and maybe you can comment on this, when do you think stool tests would be really indicated to order? And then what are some things that you might not be able to get out of a stool test?
I think that it's always a good idea. It is a tool in our toolkit, especially I see a lot of cases where patients have hopped around. They've gone to a lot of different practitioners, and maybe they've been given, treatment protocols anecdotally, maybe they haven't, but point being, they're not getting results. They have really stubborn symptomology that people can't help them get to the bottom with. And at that point, if you've never done a stool test before, it's an obvious choice, in my opinion. It's a place where a lot of practitioners start. Like I said, it is a first line test for a lot of functional practitioners out there, myself included. As far as its limitations, there's a lot of things it can't do. I mean, you can't get a blood sugar result out of stool. You can't get, some of our more metabolic things like glucose and insulin, nutrient concentrations. I mean, you can certainly get insight into malabsorption and inflammation out of stool, but you're not going to get nutrient levels, for example. You can't get a vitamin D level from stool. You can't get B vitamin levels, things like that, B12. So it's not the only test that you need for a complete workup, but a lot of times it is a good place to start, and it can kind of open the door for other avenues that you need to explore further.
Well, Kat, thanks for putting all this into context, and we really appreciate your time. It just goes to show that, all of these are tools that are in part of the toolkit that we could use in assessing patients and dealing with them. But perhaps even more importantly, it also goes to show the team that needs to be present to be able to do this. And you at Diagnostic Solutions, you help provide some level of support so that clinicians can better understand these tests too, don't you? And so because of that, I feel like we're not alone when we're trying to look through these tests. If you had anything that you'd like to end on, Kat, or maybe a takeaway for everyone listening, please go ahead.
Yeah, I mean, I'd say, don't be put off. I know it's not the most ideal scenario. It's not something we like to think about, but, everybody poops, so to speak. And, don't let your squeamishness get the better of you. I mean, I have worked with people where it's like, there's no way I'm going to do that. Absolutely not. But I feel like it can open the door for information that nothing else can. And, for that, it's worthwhile. And a lot of those people that, initially were like, absolutely not, no way in hell, eventually they come around because they're not seeing results by other avenues. So, and yeah, we are here for support. Most functional labs out there do have, education available. So just ask, whether or not it's written tools. Most functional labs do offer some sort of educational consult direct to practitioners, not always directly to patients, but so just ask if you're using a lab and you're confused. More than likely they have support available.
Well, thanks, Kat. We appreciate your time, and we appreciate you spending a little bit of conversation with us on the podcast.
Thank you.
Yeah, my pleasure. You guys have a great rest of your evening.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. Where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.